Welcome, future patient care assistants, to this training module explainer. Today, we're tackling something that's, well, it's one of the most challenging, emotionally taxing, yet absolutely vital parts of dementia care. When you start stepping into the homes and rooms of your future patients, you're going to face situations that demand way more than just clinical knowledge. You'll need profound empathy and, honestly, some really quick thinking. We're zeroing in on managing dementia-related hallucinations today. Because, listen, your response in these moments, it can literally be the difference between a night of absolute terror for your patient and a night of peaceful rest. Okay, let's dive into this. So here is our roadmap for this explainer. 1. Experiencing dementia-related hallucinations. 2. The wrong way to respond. 3. Understanding the brain's role. 4. The right way to respond. And finally, 5. Practical tips for caregivers. Part 1. Experiencing dementia-related hallucinations. To actually help a patient going through a hallucination, you first have to grasp just how intense this conflict really is. I mean, this isn't just some minor confusion, right? This is a completely altered reality that usually hits right in the middle of the night, totally flipping the caregiving environment upside down. Just picture this. It's 2 a.m., your patient suddenly wakes up absolutely terrified by something they see in their room that, to you, just isn't there. For a caregiver or a family member, this kicks off a brutal cycle of severe exhaustion. Like our source material points out, both the caregiver and the patient end up completely wiped out during the day because, well, nobody is getting any sleep at night. The stakes are incredibly high here, and distress can spiral out of control really fast. Out of nowhere, your patient cries out for help. You rush in, and they look you dead in the eye and say, "There's an evil man in the room." Think about the genuine, raw terror behind those words for a second. To your patient, perfectly ordinary, everyday objects have morphed into a waking nightmare. That evil man, he is 100% real to them, right in that moment. Their heart is pounding out of their chest, they're looking directly at you for protection. And how you respond in the very next 5 seconds is going to dictate absolutely everything that happens next.
Part 2. The wrong way to respond.
Now, human instinct often leads us right down the wrong path when someone is seeing something we can't. Let's look at how an untrained caregiver usually reacts to this kind of high-stress, late-night panic. The most common, but honestly the most damaging response sounds exactly like this. "Mom, please, there's nobody here. No one's here. Just go back to bed. Look, empty room." They might even toss in "We've got a big day tomorrow. Come on, let's go to sleep." This dismissive reaction is incredibly dangerous. By arguing with your patient's reality, you are completely invalidating their very real, very visceral fear. You're basically using logic to fight a battle that logic literally cannot win. Telling a terrified person to just go back to bed when they firmly believe a dangerous man is standing in the corner, that solves absolutely nothing, and it's guaranteed to spike their panic even more. Part 3. Understanding the brain's role. So to stop ourselves from falling into that trap of flawed logic, we have to fundamentally shift how we view the hallucination itself. As future PCAs, you really need to look beneath the surface behavior and understand the underlying medical reality inside your patient's head. Now, what's really interesting about this slide is that a person with dementia experiences hallucinations when the disease actually damages the specific regions of the brain responsible for interpreting sights and sounds. They aren't just making it up. They're certainly not trying to be difficult. Their brain is physically misfiring, altering how they interpret their surroundings, which causes them to see or hear things that simply are not there. To them, neurologically speaking, the hallucination is entirely real. And this brings us to a massively important contrast in caregiving techniques. The wrong way, as we saw, is arguing with logic. When you say no one is there, you're essentially picking a fight with a damaged brain. It frustrates the patient, and frankly, it exhausts you. But the right way is validating and solving. By saying something as simple as, "Let me take care of it," you instantly pivot from frustrating the patient to actively stepping right into their reality to fix the problem. You stop being their adversary and you become their protector.
Part 4. The right way to respond.
Let's look at exactly what that right way sounds like in the real world. Once you truly understand that their brain is just misinterpreting the room, you can adopt a deeply reassuring tone to diffuse the crisis. Imagine that same terrified patient crying out about the evil man in the room. But this time, the caregiver responds differently. "Oh, really? Let me take care of it." "I see. I'll take care of it. Can you stay out here?" "Okay, now he's gone. I'll sit with you until you go to sleep." Do you feel the immediate shift in tension there? By validating the fear and offering immediate physical protection, the caregiver calms the entire situation in an instant. They acknowledge the threat in the patient's mind, they handle it, and then they promise to stay close.
But wait, How exactly did the caregiver get rid of this evil man? Well, they did it by identifying the physical trigger. In this specific case study from our source, that terrifying evil man was actually just a coat rack sitting over in the shadows of the bedroom. Because the patient's brain was struggling to interpret shapes and light, that totally normal inanimate object transformed into a threat. The caregiver's brilliant, simple solution was just removing it from the room. They suggested keeping the coat rack outside the bedroom to hold jackets, and just like that, by eliminating the object, they completely eliminated the hallucination. Problem solved.
Part 5. Practical tips for caregivers. So the crucial point is that your job isn't to somehow fix the dementia. Your job is to manage the environment, to prevent these terrifying misinterpretations from ever happening in the first place. A fantastic strategy for reducing these nighttime episodes is to identify and eliminate triggers way before the sun even goes down. You have to train yourself to look around the room and really try to see things through your patient's eyes. What could they possibly misinterpret? Start actively scanning the bedroom for common culprits. We're talking about open curtains that might reflect light strangely, dark shadows cast by furniture, mirrors that might make them think a stranger is staring back at them, or even televisions left on in the bedroom that pump confusing sights and sounds into a dark room. Beyond just removing triggers, you need to proactively build a safe, calming space. Toss a nightlight in there to create a more peaceful sleeping environment, because a little bit of soft illumination actually helps the brain interpret shapes correctly. Most importantly, always remain calm. Do not yell or scold your patient when they're afraid. Remember, they literally cannot help what their brain is showing them. And finally, if these hallucinations keep happening even after you've tried eliminating all the environmental triggers, you need to note it down and make absolutely sure it gets discussed with their doctor. And this brilliantly illustrates the core workflow you really need to memorize. Think of this as your absolute standard operating procedure for every single shift you work. Step 1, remain calm and reassuring. Step 2, look around the room, see through their eyes, and find what they're misinterpreting. Step 3, act decisively to remove that trigger, whether that means moving a coat rack or just closing a curtain. And Step 4, gently help them back into bed and reassure them that they are completely safe. As you step into your new role as a patient care assistant, you are going to be the anchor for people who are adrift in a world their own minds are distorting. You now have the knowledge to look right past the frustration, understand the pure biology of their fear, and alter the environment to bring them peace. So I want to leave you with this final thought to carry into your clinical practice. When your patient's reality suddenly turns frightening, how will you use your empathy to bring them back to safety?